So Representative Greenlick, we're talking to people about the single-payer legislation, Medicare for All legislation that's come up. And first I'd like to ask if you're supporting it this session and how strongly you plan to support it.
Well, I don't actually support that bill this session. I really support the principle. I support moving toward universal access for everybody. I fought for that for the last 50 years. It's been very important to me. I think that's not the particular way to go at the problem in Oregon.
What would you see as the way to go?
Well, I think in Oregon we move in an incremental way. I think the possibility of passing that out of the legislature is virtually nil. And I think we're doing very important work with the transformation of the Oregon Health Plan and with the Health Insurance Exchange. We're moving toward where I think we need to be, which is universal access for every Oregonian.
When we talk about universal access, one of the things that comes up is affordability and making sure that everyone, despite their income, can get health care. How will the new CCOs and some of the transformation issues help that?
Well, when I talk about universal access, I really mean universal access to affordable, effective, and high-quality care. The CCOs, which are transforming Medicaid, I believe can be expanded. And I believe as we go from the Medicaid limits at 100% of poverty to 130% of 138%, we're going to add another 200,000 people to Medicaid, which will be totally covered by the federal government. That adds 200,000. I think the exchanges, which with their federal subsidies, will probably add another 300,000 people into the health insurance pool, largely supported by federal subsidies. So I think we could move very easily when we bring, say, PEB and other state-supported plans into using CCOs. We have a fighting chance to make that care much more affordable. It is getting out of control right now.
And one of the things that's getting out of control is the rising price of premiums since the Affordable Care Act passed. A lot of people, even if they are getting their own insurance and can afford it, now paying up to $700, $800, $900 per single person. How would you suppose we address that?
Well, I think once we have an exchange, people up to 400% of the poverty line, which is about $92,000 a year for a family of four, will have a pretty significant level of federal subsidies to help pay for the rising costs. Incidentally, I don't think the ACA has caused any rising costs. I think it's the insurance industry is trying to find excuses for raising premiums and saying, well, the poor people will be able to offset those. But I don't think the cost of health insurance should rise because of the ACA. I think that's a myth.
What else do you feel you could do in Oregon to address some of the rising costs of health care and the bankruptcies that are happening and the hardships families are facing?
Well, I think we need to make sure people have access to health insurance that will prevent that. It is true now that there about 25% of all bankruptcies in the United States are caused by health care costs, but I think we have the potential to deal with those questions for people up to, say, 400% of the poverty line.
And I guess the last question, I'm playing devil's advocate with you. For the people who are going to say that their families have been devastated, or yes, we have health insurance through work, but it doesn't cover X, Y, Z, or people who are on the 400%, but will be paying some pretty high premiums anyway, what do you say to people who feel like they are being so squeezed by healthcare costs and are choosing between rent, housing, and those sort of things?
I'm saying we're working to find ways to reduce that, and the more we can do to reduce it, the faster we can. We're going to do that. But I don't think in Oregon we have the possibility of getting a universal answer. I supported the constitutional amendment to make health care a right. I was hoping that this session, Healthcare for All Oregonians, would be sponsoring a referral to the voters to make it a constitutional right. I think if we make it a constitutional right, then we have the ability to come back and fight for more dramatic methods. But the organization chose not to support that in this session.
How do you see that as being an alternative? That's interesting. How do you see that as being an alternative, saying the voters can put it on the ballot as a constitutional right, and then the legislature can go back and address it as something the voters have passed?
I think the legislature can address it. I mean, if we change the Constitution as I proposed in 2003, and I mounted a campaign we got 125,000 signatures, but we were about 20,000 short. That essentially my wife and I ran the campaign ourselves with help from our friends. If we put it in the Constitution and then makes it a responsibility of the legislature to work to implement that. So I think the answer is put in the Constitution, make sure we've made that point as an important point that all Oregonians do have a right to affordable and effective health care. It is then incumbent on the legislature to figure out how to make that happen.
All right. Thank you. Do you have any other questions?
Yeah, I do. You mentioned that you've been in the legislature for quite a few terms, and I'm curious, over that time, have you seen a level of partisanship increase as we have nationally? And how would you comment on the ability of healthcare legislation to get passed, given that level of partisanship? Is it a partisan issue?
Well, it's certainly a partisan issue, but the fact is we proved in the last session that we don't have that same level of partisanship. We passed the transformation of the Oregon Health Plan and the exchange in a legislature that was divided 30-30. So I mean, we had a shared speaker system, we had shared committee chairs. I mean, and those two bills passed with more than 50 votes out of 60 in the House. So we were able to get people to understand what the needs are. I think if you bring too radical approach to it, then it immediately becomes a partisan issue. Although I don't think I could get a majority of the Democrats to vote on this bill. I mean, I helped sponsor the last session. I had a hearing on it, but it's clear that that bill is not going anywhere. And I think in any future legislature, regardless of what the split is.
So basically you're saying that if the legislature hears that it's a will of the people, that even the Republicans or the more conservative people would be more willing to take a closer look at it.
Well, I think we're all working to try and provide access to affordable care. I think there are just a pretty wide difference on the belief of how to do it. I think the people on the right are more likely to say you should use market models to move that way. The people on the left are saying, well, we should have things like a public option, which I would very much support in the exchange. I think there are other ways to get to, say, 95, 96, 97% access to health care.
Are we going to have a public option in the Oregon Exchange?
I hope eventually we will. It's very much on my downstream agenda.
Do you think Oregon is in a position to show leadership to the nation on how it manages its own healthcare challenge?
I think Oregon is showing leadership to the nation on how it's managing its healthcare problem. I think the way we moved on the exchange and on transformation of the Medicaid program, we are way ahead of almost anybody else in the country. If we keep pushing that model, I think we can stay ahead.
Debbie, any questions?
No.
Thank you very, very much. Appreciate your honesty. Really
You're quite
appreciate
welcome.
that.
It's fun.
Yeah.
Thank you.
This is very important to me, and I really have been working on this for nearly 50 years, so it's very close to my heart.
Hope I can help make something happen.
Let's do it.
Thank you.